Yes, hello guys, it's your boy Rico, daktari mwenyewe, na thank you guys for coming back to my YouTube channel. And today we are going to talk about UTI, urinary tract infection. This one, a bacterial infection, mostly affects the kidneys, urethra, and the bladder. So patients with symptoms and signs, patients come with headache, suprapubic tenderness radiating to the back, and also with the joint pains, also fevers, chills. Those one are also the symptoms. So we do a lab test just to rule out other infection like malaria, bacteria infection through the blood. So you do to identify this infection, you do a urine dipstick that shows the bacterial infection, like identifying with the leukocytes, and leukocytes is from trace to 3 plus, which identify the severity of this infection. You do a microscopy to identify when the patient there is a passage in the urine, and also you do ultrasounds just to check on the kidneys, the urethra, and the bladder. So you can miss this infection through a urine stick, but you get it through a ultrasound, like pyelonephritis, cystitis. Those one you identify through the ultrasound. Then these patients, we want them to get a clear treatment. So from treatment, you start with maybe lifestyle, the supportive treatment first. You tell this patient to take a lot of water that clears the infection, so the patient goes to toilet more frequently, then the infection is washed away with maybe going to the loo every time. Hygiene, maybe washing the private clothes very well, and sun drying them very well. The material that should be ironed, you tell them to iron them just to kill this bacteria. And then you tell them the treatment should be done on both partners. So both partners you treat for this infection, because you find male partners, they don't experience these symptoms and signs immediately. The infection must be chronic, because they have the gland that supports to kill this bacteria, the prostate gland, that organs fight this bacterial infection. First, for female, they show this infection more more quick, and they respond good to this treatment, because the infection they get to when it's at acute phase. So for the clients who have been treated for this infection for many times, we advise them to do a urine culture just to identify the specific organism, whether it's a gram positive or a gram negative. And also we identify the specific drugs that kills this infection, instead of meandering through the antibiotics. So you don't guess, you go to culture and identify the antibiotics that kill this bacteria very fast. So guys, thank you for watching, and please, if you have not subscribed, subscribe, and thank you so much.